Hello, you're here with Antonio, Irina, Melissa, and Rebecca. We're here to talk about Sentinel Events.
What is a Sentinel event? It is any unanticipated event in a healthcare setting resulting in death or serious physical or psychological injury to a patient or patients not related to the natural course of the patient's illness. Such events are called sentinel because they signal the need for immediate investigation and response. The terms sentinel event and error are not synonymous. Not all sentinel events occur because of an error, and not all errors result in sentinel events. Types of sentinel events. There are many types of sentinel events, such as wrong site surgery, medication errors, and criminal sentinel events, are just to name a few. Who is affected? They can happen in any facility at any time. No organization or individual is immune. Sentinel events aren't confined to substandard organizations. Many involve highly respected healthcare systems and practitioners. Why are they happening? Sentinel events most often occur because of a hospital problem and not just from one individual person. A sentinel event could be from inadequate communication, incorrect assessment of patient's condition, and inadequate leadership and training. What to do? Such events are called sentinel because they signal the need for immediate investigation and response. Each accredited organization is strongly encouraged, but not required, to report sentinel events to the Joint Commission. Organizations benefit from self-reporting in the following ways. The Joint Commission can provide support and expertise during the review of a sentinel event. The opportunity to collaborate with patient safety experts in the Joint Commission's Office of Quality and Patient Safety. Reporting raises the level of transparency in the organization and promotes a culture of safety. Reporting conveys the healthcare organization's message to the public that it is doing everything possible, proactively, to prevent similar patient safety events in the future. Further reporting the event enables lessons learned from the event to be added to the Joint Commission Sentinel Event database, thereby contributing to the general knowledge about sentinel events and the reduction of risks for such events.
I will be talking about wrong site surgery. What is it? Wrong site surgery is a surgical error in which healthy, non-affected limb, organ, or other body part is removed by mistake. This can cause major emotional and physical damage to a patient. If the patient is having a diseased kidney removed and the healthy one was inadvertently removed, the patient would lose all kidney function. Similarly, a patient undergoing amputation of a leg or arm would result in a complete loss of both limbs, leaving them permanently disabled. How common is it? Wrong site surgery is the fourth most common type of sentinel event. Who is committing these mistakes? Of all the incorrect procedures committed, 41% were done in orthopedics and podiatry surgery, 20% in general surgery, 14% in neurosurgery, 11% in urology, and the remaining specialties include dental, oral maxillofacial, cardiovascular, thoracic, ear, nose, and throat, and ophthalmic surgery. So, who reports these mistakes? Reporting is done either by the provider who made the error or the patient and their legal representative if the mistake is apparent. Healthcare providers may be underreporting incidents due to many factors. Our society, the media, and the medical society have always tended to name, blame, and shame the person at fault. Healthcare personnel, therefore, have been quite understandably concerned about personal consequences. Many facilities now have a logbook for sentinel and near sentinel events, which is for quality control and prevention. The benefit of this book is that it does not require the person committing the error to list their name, just the type of incident. Unfortunately, this may not resolve underreporting, as the stigma still exists. What is being done to remedy this situation? In an effort to reduce the occurrence of wrong site surgeries, the World Health Organization launched a mandatory global safety challenge. Patient surgery saves lives. The checklist has 3 components: sign in, time out, and sign out. The checklist requires staff to verify the correct patient, procedure, and that all surgical equipment is accounted for. at specific times, which include before the induction of anesthesia, after induction but before surgical incision, during or immediately after wound closure, but before removing the patient from the operating room. This procedure can reduce the risk of human error as well as increase vigilance and awareness during operations.
I'm going to talk about medication errors. So what exactly medication error? Medication error is any preventable event that has potential to cause or lead to inappropriate medication use or patient harm while the medication is in control of the healthcare professional, patient, or the consumer. So what are the reasons? Why is this happening? Well, incomplete, confusing orders. I'm sure many of you already seen the doctor's orders, their cursive writing. I wonder sometimes can the doctor read it? Similarity of drug names, narrow therapeutic index, high alert drugs, patient's individual response to the drug therapy, interruption of nursing staff during medication administration, fatigue due to long hour shift. So basically, according to the Joint Commission, high alert drugs, even given correctly, are often associated with serious harm that can cause injury or even death. Drugs with a narrow therapeutic index are dangerous because small changes in dosage or blood drug levels can lead to dose or blood concentration dependent critical therapeutic failures or adverse drug events. These adverse events are persistent, life-threatening, permanent, slowly reversible, and can lead to disability, the need for hospitalization or death. So insulin errors, this is a very common error that's happening in hospital. I mean, I'm sure all the nurses, all the nursing staff know the 5 rights, but somehow people forget about it. So it happens due to clinician errors, self-administration errors, self-monitoring errors, wrong route, insulin timing, wrong type of insulin, wrong dosage, wrong syringe, wrong abbreviation. For example, you are not supposed to use letter U for the units because it can be confused as a number 4 or 0. So, and also using an incorrect carbohydrate ratio, not rechecking blood glucose, and post-injection. Anticoagulant error. So these errors happen pretty much for the same reason as the insulin errors. Not only nurses have to be aware of the potential side effects and harm to the patient also has to be educated to identify possible bleeding and let the nursing staff know what's going on, and also know like the nurse needs to think about the wrong patient, wrong dose time, wrong route, wrong situation, lack of monitoring lab result, individual's response to the therapy, and a previous home medication. So anticoagulants were linked to about 60,000 errors from 2001 to 2006. So roughly 60% of these errors reached the patient, and about 3% caused death or harm. And then from January 97 to December 2007, 446 medication errors, Sentinel Events, were reported to Joint Commission. Opioids. So many patients are receiving opioids in the hospital due to whatever injury they received, and also after the surgery. However, the nurse have to make sure to assess, do a focus assess on neuro and also respirations. Depressed breathing is the most dangerous side effect of opioid overdose. Lack of oxygen to the brain can not only result in permanent neurologic damage, but might also be accompanied by widespread failure to other organ systems, including the heart and kidney. If a person experiencing an opioid overdose is left alone and asleep, the person could easily die, and their respiratory depression worsens. Sedatives. I'm sure you already heard that joke about the nurses giving a nap time to their patients. You know, they're giving them some sedatives for the night, but then you go there in the morning and the patient is not really arousable. You know, they're still napping. So sedatives can cause drowsiness, dizziness, confusion, problems with movement and memory, slow heart rate, breathing. You have to be very careful with geriatric population because due to their physiological changes with an age, they might need a lower dose. So, interruptions during medication administration. If you go to the Pixie room, you often could see many nurses talking, you know what I mean, chatting. However, while the nurse is taking medication from the Pixie, no one should disturb her. No one should talk to her, and because she has to focus on her patient and medication. So as you could see in this picture, you know, all the nurses are chatting. They're trying to sell the cookies.
So I'm going to be talking about criminal sentinel events. You may have seen that movie Catch Me If You Can, where you have a high school boy that was impersonating a physician in Georgia. Those are the rare cases of an impersonation. You may also recall from obstetrics, abduction of newborns or babies. Another criminal sentinel event, other popular criminal sentinel events are rape, assault, and homicides of any patient receiving care, treatment, and services while on site at the hospital. The assault, rape, and homicide category of sentinel events is consistently among the top 10 types of sentinel events reported to the Joint Commission. You may be asking, why are these occurring? About 62% of the events are noted as a leadership problem, most notably in the areas of policy and procedure development and implementation. Human resources related factors are noted in 60% of the events, and assessment issues are noted in 58% of the events. And then other less identified factors include problems in planning, information management, and patient education. How would you prevent criminal sentinel events? Well, in human resources, proper screening of employees and procedures that minimize violence when disciplining and firing employees should be implemented. You don't want to have an employee get angry about being disciplined or fired. Also, identifying potentially violent individuals as they enter the hospital, and just hospitals being aware of the community around them can help decrease criminal sentinel events. Proper psychosocial assessment of the clients is another big one. Violence management training for staff members, and also violence de-escalation tools will help prevent criminal sentinel events.
So prevention strategies. A way to help prevent the sentinel event of wrong site surgery is to use Safe Surgery Saves Lives and incorporate the checklist during all procedures performed. Ways to prevent medication errors are to slow down when pulling medications and decrease distractions. One hospital created a no interruption zone by encircling the area around the medication cart with red tape to indicate nurses inside the red zone weren't to be interrupted. Over a 3-week period, interruptions decreased by 40.9%. Nurses must also be sure to perform all their safety checks when getting and giving medications to help reduce the incidence of an error from occurring. Preventing criminal sentinel events can be prevented by a good human resources department and screening employees when hired and educating staff on events that could potentially lead to a criminal sentinel event. Not all events can be prevented, however, it is important to promote safety, listen to staff, and educate as needed to decrease the incidences of sentinel events. Decreasing sentinel events. Even with all the hard work on studying and analyzing sentinel events, they still occur. It is important to focus on the prevention of sentinel events as much as possible. Not all events can be prevented, however, it is important to promote safety, listen to staff, and educate as needed to decrease the incidences of sentinel events.